Bucco exposes Democrats' ignored warnings on public employee benefits crisis. NJ Politics 2025. New Jersey faces a fiscal time bomb. Democrats ignored repeated warnings about the accelerating collapse of public employee benefits, and the consequences are now unavoidable. But this is just the tip of the iceberg in Trenton's fiscal mismanagement. Senator Bucco has consistently sounded alarms about systemic failures, exemplified by BPU Commissioner Abdu's recent resignation. This resignation wasn't just bureaucratic shuffling, it reflected profound policy dysfunction that impacts every taxpayer. Here's what most people miss. While Bucco secured tangible wins like expanding prosthetic coverage and safeguarding students with disabilities, Democratic leadership simultaneously allowed foundational programs to decay. Their budget process? Bucco bluntly calls it no way to run a government, pointing to reckless spending habits. And here's the controversial part. When Republicans proposed solutions to lower energy prices, Trenton Democrats systematically blocked them, choosing ideology over affordability as utility bills skyrocketed 800%. The property tax crisis epitomizes this failure. New Jerseyans now shoulder $10,000 average bills, a direct result of fiscal negligence. Bucco's legislation, like simplifying accountant licensing or supporting veterans with therapy dogs, shows practical governance. Yet Democrats prioritized political maneuvers, like delaying energy cost hearings they themselves caused. Now, consider this: as Bucco champions cancer research funding and business grants post I-80 sinkhole, the administration kept pushing unaffordable EV mandates even after Connecticut abandoned similar plans. Why double down on policies that harm working families? And with the BPU accused of gimmicks to hide rate hikes, one must ask, is this leadership protecting constituents or protecting political power? What's your take? Should policy prioritize people over politics, or is this criticism unfair? Share your perspective below. This debate affects every New Jerseyan. Fixing New Jersey's state health benefits plan, CWA District 1's response. New Jersey's public employees and retirees are caught in a healthcare disaster, and recent government decisions have actively deepened the crisis. Here's the shocking truth: the state's health benefits system isn't just broken, it's being systematically dismantled while workers bear the crushing consequences. But what's really fueling this emergency? A perfect storm of funding cuts, unchecked corporate profiteering, and astonishing administrative failures. In a move that shredded hard-earned union contracts, the FY 2026 budget slashed $100 million from the State Health Benefits Plan, SHBP. This isn't just budget tightening, it's a direct cost shift forcing workers and retirees to shoulder unbearable financial burdens. Compounding this injustice? A fundamentally broken rate-setting process just imposed yet another round of double-digit premium increases on families already struggling to make ends meet. But here's where it gets explosive: while prescription drug costs soar through the roof, the administration stubbornly rejects common-sense cost controls that other states successfully use. Why? That's the million-dollar question with alarmingly few answers. The real infection poisoning the SHBP isn't just financial, it's a complete lack of accountability. The plan operates in disturbing secrecy, with zero transparency and absolutely no meaningful input from the workers and retirees who both fund and depend on it daily. Now, here's the solution that could turn the tide: Assembly Bill A5903, championed by Assemblymember Varelli. This landmark legislation would fundamentally reform SHBP governance to include essential voices from labor unions and local governments. Mandate unprecedented transparency from insurance carriers and pharmacy benefit managers. Guarantee affordable plan options tied to stable wages rather than unpredictable premium spikes. We urgently need the Senate to introduce parallel legislation immediately. And here's the controversial reality check: had the administration implemented even half of the cost-saving measures proposed by their own SHBC and Plan Design Committee, this crisis would never have reached catastrophic levels. The long-term cure must include reference-based pricing, the proven strategy to permanently contain runaway healthcare costs that other states are adopting. CWA and our coalition partners stand ready to meet 24/7 to fix this emergency. But we pose this provocative question to every New Jersey taxpayer and public servant: when an administration ignores practical solutions during a full-blown healthcare collapse, is that incompetence, or a deliberate strategy to undermine worker benefits? The silence is deafening. Where do you stand on this life or death issue for thousands of families? Voice your outrage or agreement below. About CWA, the Communications Workers of America is a powerhouse union representing workers across public service, telecommunications, customer support, media, airlines, healthcare, education, manufacturing, technology, and numerous other vital sectors.